Exclusive: US/CDC staff inside China prior to coronavirus outbreak. Washington: The Trump administration cut staff by more than two-thirds at a key US public health agency operating inside China, as part of a larger rollback of US-funded health and science experts on the ground there leading up to the coronavirus outbreak, Reuters has learned. Most of the reductions were made at the Beijing office of the US Centers for Disease Control and Prevention (CDC) and occurred over the past 2 years, according to public CDC documents viewed by Reuters and interviews with four people familiar with the drawdown. The Atlanta-based CDC, America's preeminent disease fighting agency, provides public health assistance to nations around the world and works with them to help stop outbreaks of contagious disease from spreading globally. It has worked in China for 30 years. The CDC's China headcount has shrunk to around 14 staffers, down from approximately 47 people since President Donald Trump took office in January 2017, the documents show. The four people who spoke on condition of anonymity said the losses included epidemiologists and other health professionals. The material reviewed by Reuters showed a breakdown of how many American and local Chinese employees were assisted there. The documents are the CDC's own descriptions of its headcount, which it posts online. Reuters was able to search past copies of the material to confirm the decline described by the four people. The CDC office in Beijing is a shell of its former self, said one of the people, a US official who worked in China at the time of the drawdown. Separately, the National Science Foundation (NSF) and the United States Agency for International Development (USAID), the Global Relief Program, which had a role in helping China monitor and respond to outbreaks, also shut their Beijing office on Trump's watch. Before the closures, each office was staffed by a US official. In addition, the US Department of Agriculture (USDA) transferred out of China in 2018 the manager for an animal disease monitoring program. Reductions at US agencies sidelines health experts, scientists, and other professionals who might have been able to help China mount an earlier response to the novel coronavirus, as well as provide the US government with more information about what was coming, according to the people who spoke with Reuters. The Trump administration in February chastised China for censoring information about the outbreak and for keeping US experts from entering the country to assist. We had a large operation of experts in China who were brought back during this administration, some of them months before the outbreak, said one of the people who witnessed the withdrawal of US personnel. You have to consider the possibility that our drawdown made this catastrophe more likely or more difficult to respond to. The White House declined to comment or respond to questions from Reuters regarding the US with the rollout of staff in China. The CDC did not respond to detailed questions submitted by Reuters about the cuts. It has insisted that staffing levels did not hinder the US response to the coronavirus. There are many factors that go into decisions around staffing, the CDC said in a statement. Some health experts were skeptical that more CDC employees operating inside China would have made a difference in stemming the outbreak. Beijing has been widely criticized for silencing its own public health officials who warned of a deadly new respiratory disease emanating from the Chinese city of Wuhan and surrounding Hubei province. The problem was China, not that we didn't have CDC people in China, said Scott McNabb, a former CDC epidemiologist who is now a research professor with Emory University. He pointed to China's censorship as the main culprit in the spread of the pandemic, which has infected at least 417 people worldwide, killed 19,598 and 598 and upended the global economy. China's embassy in Washington, D.C. declined to comment.